Mr. Speaker, I rise today to talk about the health care crisis that we have in America today, primarily about the physician shortage that exists throughout the entire United States. It's a crisis that we must do something about. In the next 15 years, the United States is expected to face a shortfall of over 4,000 primary care physicians alone. Rural and low-income communities, many of which I represent, are expected to feel the brunt of this shortage. Communities such as those in California, like the San Joaquin Valley. The San Joaquin Valley has the lowest numbers of physicians in the state, approximately 0.9 physicians per 1,000 people. That's less than one. Statewide average is 2.2 physicians for every 1,000 people, which is twice as many. Last week, I introduced legislation to help tackle this crisis. The Expanding Medical Education Act of 2020 will provide over $200 million in funding to promote medical training in areas of high need throughout the country, like the San Joaquin Valley, with a focus on diverse and medically deprived communities. We have Governor Gavin Newsom's support and our local legislators on this effort, this legislation. Medical institutions such as the University of California of San Francisco have used funding from this effort to train and develop homegrown physicians under the residency program for 45 years in the Valley and throughout the state. It's very important. And we've discovered that when you train physicians locally, residents, they are more inclined to practice in that area, and in our case, in the Valley, and bring health care to our communities. Studies consistently show that students who can find quality education near their homes and families will be more likely to stay there after graduation. It's just common sense. Growing our own doctors is essential to confronting this medical crisis. And I will continue to fight for every dollar to ensure that our Valley residents have access to the necessary health care that they deserve.